So answering a couple of questions, I was just listening to all of you, for the question that Misha just asked about interviewing late or early in the day, I'm going to let the speakers answer that as well. But just my experience as a faculty member, which I noticed, there is something called as faculty interview fatigue as well, So what happens is that when you start interviewing applicants October, November, December, January, all right, sometimes in the early part of the interview cycle, everyone is really like eager to ask about you and get to know you better, and because they are like kind of fresh, they're new faculty members, and they're really like looking out and taking a more conducive and more like a comprehensive interview. What I noticed at the fag end of my interview season, like when we were interviewing people, come January, people think that, we remember them, but at the same time, try and see that the faculty members are also fatigued out. So they get bored out in answering, questioning the same sort of thing, same patterns and everything like that. So a lot of times, your answers may just sound like monotonous to them, like they're like, okay, it's the same old answer. But October, November, December, maybe like, like when they're not that fatigued out from the interview process, I think it's probably fine. So, to answer the question is that if you do get an interview invite, don't delay it for long just for that one purpose that, like you want to keep it so that, you'd be remembered. If you do a great job, because the interview is ranked right after you guys leave. So we get an interview, um, like a sheet, and we can just kind of decide at that time because we are supposed to submit it to the program coordinator at that time. I'm gonna show you guys one thing that is actually in my office right now. If I can share this with you. So this is a fellowship program interview, and this is the same thing that we use for Marshall interview as well. If I can kind of, Google it, like, just show this to you guys. So can you see my video right now, all of you?
Yes, we can.
Okay, so let me just turn the camera the other way. Can you see this? So this is how I would rank my applicants. So these people interviewed here yesterday. I'm going to take their name off from, like, of course, for privacy purposes, but this is the interview sheet that we get. So this is the interview invite. And to answer the question that, do we rank them on the first day or not? So we rank them right away, and this will not change. So this was interview date yesterday, 10/7/22. And all these things are the ones that we rank for. So English proficiency, accent, must concentrate, understand. 4 and 5 is like primary language. Communication skills, that you can rank them over here. There is an interest in the program. This is a very important point, just because that tells me that you have read about our program, area, and for example, my program is solid malignancy program. And if someone comes in saying that I want to do marrow transplant and I want to do CAR therapy and stuff like that, that will tell me that you haven't really researched about the program and what's the goal of the research, right? So that will just down if you're going there, like if you're going there to just see chronic diseases or acute case, like that's a very urban program. So you have to be understanding of those things. Then is shovel, good, very good, and cleanly professional. So I would rank this candidate. This is where it all comes down as a subjective assessment. Okay. So this is where I will have as a faculty member the bottom 50, top 50 to 75%, top 25%, and top 5%. I'm pretty liberal and generous with my assessments, but overall impression, and this is basically these are the two things that your interview, when you interview with any faculty member, they will basically rank you in these sort of measures. Um, I want to share you one more thing as what the faculty receives when we get you your interview. So for example, you get this picture, okay? Uh, these are the ERAS application that we get for you guys. And this is all printed out nicely. So, like it just has everything in there. So, and we do read this maybe like 15 minutes, 20 minutes before. We don't read this like a day before. Some programs may do that, but we read them right when we are waiting for the interview presentations for the guy to come into the thing. Really important hobbies and interests. I've not had an interview in which I don't ask about these things. So, because at the end of the day, you want to know about that individual that's coming to your program. So come up with something nice, but something that you can back up with examples, not just putting there, for the sake of it. So be careful about this. You can kind of experiment about it, but you just know what you're talking about because that person may be an expert in that field. Okay. Um, I always want to kind of point out when you guys are doing the ERAS application, so Urdu, English, Punjabi, whatever you want to do, you can add Hindi to that as well because you can probably go for it. This is how you get your personal statement. Important that it fits within that domain of the pages. So this one is coming out on 2 pages. So just kind of like a small pet peeve that I have, but that's it. So and the same thing for these patients, like for these individuals, just getting all these data in there. But the two things that I would really have focus on is I would rank this candidate or not, an overall impression. And my program coordinator would see that if I'm ranking this in top 5%, she will definitely be ranking them as high as well. These could be anything, but if I am ranking these two things, the top 5% and the overall impression, they will go by that because this is like pure subjective assessment for these, page for these candidates. Um, the other thing that I want to bring out is that you guys mentioned about, the Sikandrabad experience. That's great, but just be careful with that. Just because I've noticed that if you talk too much about it, what happens is that there is a tendency for the program to think that you're coming from a very rural area, and that's not the case. He is a very sort of a I think it's an urban metropolis, so I would label it that way as well. This is just from my experience. I'm sure you guys may have different experience in it, but I feel that you should label Karachi as an urban metropolis so that when the program sees you, they don't see that you're coming from a very rural sort of a place. You're coming from a very bustling urban metropolis. So when you talk too much about a rural area or area of need sort of thing, they go back to and then this kind of stereotype you in that thinking because the guy over here in Oklahoma or in West Virginia may not know about much about Karachi. So the point that you guys raised was very good about EMR, that okay, so we have EMR over there, we have electronic testing, we have all these PCR and everything. So that tells me that okay, you're coming from the same planet. It's not going to be a big difference in terms of what you know and what I know. So these are the practical things that I would focus on. Yes, you can have Sikandrabad experience there as a community worker or community health sciences worker, but don't highlight it so much so that your other experience in working in a urban metropolis kind of goes in vain. So that's my 2 cents, but I hope this helps you. And then just schedule the interview as they come in. If the program is that something that you really want to be, you can schedule a practice interview, one or two, like to a program that you are like kind of like 50% about. You can schedule those first, get the taste of it, and then go to the program that you really want to go, maybe like sandwich them between the two programs. So kind of space them out intelligently, but not entirely that if I interview in late January or early February, I'll be matching in a program, because by that time faculty is also fatigued, and they basically have heard 100 answers of the same type. So they're like the more less likely to kind of like be open to that. So ये दो तीन चीजें थी, बाकी I think